script as well, because it's always useful to have some notes. There we go. We'll just give it another minute or two. Hayley's joined us. Welcome, Hayley. You're very welcome to have your screen on or your screen off. We want people to be comfortable. We know it's not everybody's cup of tea to have their cameras on. It is lovely to see faces, though. I'm hard of hearing. I'm partially deaf, and I do find it nice to be able to see people's faces. But be relaxed, and you're very welcome to have your dinner, because we recognise that this is at tea time. You're very welcome to be eating or drinking, whatever, lying down, whatever makes you feel comfortable. There's absolutely no pressure tonight. We had 9 people sign up, so we'll just give it another minute if that's okay, just to give people a chance in case those inevitable, like the phone rings or somebody trips over the dog or whatever happens, that might delay people getting on. I'm just going to double check my emails as well, if you don't mind, just to make sure nobody's asking for help, saying they want to get on and they can't. No, that's all fine. Lovely. So you're all very welcome. You do have a gang of us here from everyone and our partners and our friends. So we've got Helen, we've got Deborah, we've got Samantha, we've got Sharon, and you've got myself, Vicky, and I'll do proper introductions in a moment. So and there's the chat function for Hayley, especially as you've just joined us, that if you've got any questions or ideas or thoughts or comments, please do pop them in the chat, and they'll be getting picked up a little bit later by Helen. And hi, Phil, welcome. Welcome, and we're just giving it one more minute just for people that might have joined us late. The session is being recorded, just in case there's anybody that was desperate to be here and they contact us and say that they would love to be able to see what this was all about. So yeah, do introduce yourself in the chat if you'd like to. You don't have to. Like I say, we just want to make this really comfortable, no pressure on anyone. But if you want to say hi and introduce yourself in the chat, it's always lovely to get to know who we've got with us. Yeah. Sorry, we've talked about food, we've talked about the weather. I've shared with you my plans for my funeral, which hopefully won't be for a long time. So that's just me killing time while we give people a chance to join. We've talked about the music. That's why it's got pearl fishers, lovely pearl fishers in the chat, because I was asking people what their music would be, their welcome music, if we had any. And thank you, Katie. Thank you for sharing. So I'm wondering, shall we get going? Because we do only have an hour, and we purposefully set this as an hour because we wanted it to be short and bite-sized for people. Ironically, this is a session that's all about energy limit conditions, and we don't want to make it a really long session, because the last thing you need is hours and hours of screen time. So we're keeping it short, and we do recognise that this has got to be right for you. So if you do need to dip out, if you need to come off camera, or if you just need to lie down, whatever works for you, you're very welcome. So let's get going. We've got a few slides just to help us through. So proper introductions. My name's Vicky Thompson, and I have, well, I can't help but say the best job title in the world, because I'm Chief Executive of Everyone, and we're a Lincolnshire-based charity, and we work with people. We work with health and care and the voluntary sector, and with people with lived experience. And our aim as a charity is to make wellbeing personal, and that's about helping people to be at the centre of their wellbeing, and working with professionals, working with people from all the health and care sector, to help involve people in developing and designing services together, and to helping people be part of that. And one of the things that we do is co-production, and that's where we bring people and services together to make things better for all. And part of that was the work that we did around long COVID. Probably getting on for 4 years ago, we started that work. And we worked with lovely partners like Active Lincolnshire, Shine Mental Health, and with Lincolnshire County Council Connect Support. And although that funding ran out 18 months ago, 2 years ago, we've continued to meet as people with lived experience of energy limiting conditions, because we felt that although there wasn't the funding to do something, we wanted to continue to meet and see what we could do, because we felt there was more work to do. And we widened the work to not just people with long COVID, but people with wider energy limited conditions. And there's a whole list of those. I can never remember them, but people with fibromyalgia, ME, chronic fatigue syndrome, cancer through treatment, FND, mast cell syndrome, loads and loads of all those different conditions. And we're delighted to say that we got some funding because we decided to keep battling through. We knew there was some more work to do on this for the people of Lincolnshire, and we secured some more funding to run a series of events. And this is our first. And we did this today because yesterday was International ME and Chronic Fatigue Syndrome Day, and we wanted to launch our events with this webinar. And I'll share a bit more about the further events that are coming up soon at the end of the session. So because it's important to us as a charity that we work with people with lived experience, today's session has not only been developed with people with lived experience, but is going to be co-delivered with people with lived experience. And I shall bring them in one by one as we get going through the session. And one of the things that people have told us is that information is so hard to navigate. There's a complicated health and care system out there, and give us a shout out in the chat if you find it a complicated health and care system. I don't know about you, but I certainly do. And we wanted to run this section about navigating the system and finding information that feels right and feels trusted. So that's why we've set up tonight's session about information and how you can use that. So as I say, please do use the chat. We want to make sure that we get those ideas. Just to give you a run through of the session, I will be shutting up very soon. I try not to do much talking because it's not about us and what we do. It's about the content of the session. And I'll be handing over to Deborah, and I'll ask Deborah to introduce herself. And Deborah will be looking at how we understand the support that's out there and find trusted information. And then we'll pass on to Samantha, who'll again introduce herself and talk about Connect Support. And you're going to get, fingers crossed, a live demo of the Information Hub that we've supported on over the years. And then Helen, again, will introduce herself and talk us through any questions or anything that's come through in the chat. We've also got Sharon with us, who is a member of my team, everyone. And Sharon's going to be working on developing the events and inviting people to the events. So she'll be having her listening ears on to hear what people are saying that they need, so that can help to inform the events. And then I'll close us off with a little bit about the events and what's coming next. So welcome everyone. I think a few more people have joined us as we've gone along. So just a quick reminder, the session is being recorded. If we get further down after the presentations and you want to share things that you don't want to be recorded, then do just let us know. We can make sure we edit things out. So I'll pass on to Deborah. I was going to do a bit on this one, but Deborah's done such a good job with her slides, and I know she's the expert in all this, that I'm going to shut up and just leave it all to Deborah to do the hard work, if that's okay. So Deborah, are you going to do the next slide, please, bit as we go along?
I will, yes, absolutely. Thank you. Hello, everybody, and yes, welcome. So my name's Deborah Bircham, and I'm here really with three different hats on. I'm a lived experience person. I live with chronic fatigue and various different conditions that mean that fatigue is a daily part of my experience. I I'm a health coach and a mindfulness teacher, and I work with people who have fatigue. And I also work for a charity called Mast Cell Action, and we support people with mast cell activation syndrome. And the reason that I mention that is because we have some really useful resources, which I'm going to reference as I go through, which, although they relate to MCAS, they can also be very useful for people with a wide range of different conditions. So I've included some of those in the session. So I wanted to start off by exploring why is it so hard to find information about fatigue and get support with fatigue. And obviously one of the reasons for that is because the health service is in patchy in the way that it is able to support people with fatigue. So it's slightly more complicated than just getting a condition and popping along to the doctor and they knowing everything. You may not get all of the information that is available from one single source within, maybe your GP, for example. So sometimes we feel as though we've been left a little bit to try and work things out for ourselves when we're having fatigue. And that is really hard work, not only because you've probably got brain fog and you're struggling with fatigue, and reading stuff and searching is an enormous amount of work and energy, but the information is really hard to find. And one of the reasons for that is because fatigue is a symptom. It's kind of a bit nebulous. It's not actually a single diagnosis. There are so many conditions, as Vicky mentioned, for which fatigue might be a component. You might have thyroid issues or hormone issues. You might have insulin resistance, diabetes. It might be a post-viral issue. It might be a mitochondrial issue. People who have cancer treatments, people who have stroke and traumatic brain injury, all sorts of different conditions experience fatigue. And so the information that you need may well be very different to the information that somebody else needs. And because of that, the information about how to manage fatigue and how to support yourself with fatigue is really spread across multiple different organizations, different websites. There isn't a unified fatigue information center where everybody who's experiencing fatigue can get information, and people find it very hard to know where to go. And you can very easily miss things because the terminology is so varied. So we've talked about energy limiting conditions, which is becoming the more adopted term, because it encompasses lots of different conditions, and it also sounds a little bit more, or recognizes the severity of it, and not just that it's a bit tired. It's an energy limiting medical condition. But lots of people who have fatigue are not just going to magically start Googling for energy limiting condition. You might Google for fatigue or chronic fatigue or energy limitation or medical fatigue or ME, CFS, long COVID, post-viral fatigue, post-viral illness. If you type any one of those into Google and ask for information and resources, you will get a different answer every single time. So it depends very much on you knowing the terminology, and you may not, if you've just become poorly, you may not know, what do I search for here? So it can be very, very challenging. Next slide, please. So I'm not going to tell you not to Google, because you're all adults, and as I said, there is sometimes quite a vacuum of information and people do feel left and a bit abandoned, and it's natural that you want to find information for yourselves. And I think it's really important when you are living with these types of conditions to be informed and to do your own research, because we do have to become our own advocates. But what is important to do is research in the right way and with discernment, and make good choices about the type of resources that you're looking at. And it can be very frightening when you put stuff into Google. So it's important to research with the right mindset on that you are doing this to explore and to educate yourselves, but not to get drawn into the more frightening things. Oh, I think I just dropped out, but I'm back. Can everyone still hear me? So So not to get put off and worried about the more frightening things, but also to be really cautious about where you get your information. And this is why we as a group have put together what we call the Connect to Support Fatigue Hub, which Sam is going to talk us through, because we recognize this information lack and the difficulty of finding information. So we've created this hub. But there are other areas that you can search for that have trusted information on them. So charities, if you have a diagnosis, looking at the charity for your particular condition and really making the best use of the resources that they use, that they provide. And they may even have, online support groups and resources that you can download, like the ME Association or Fibromyalgia Action UK, long COVID support. Finding charities that have information is a really good place to start. Joining Facebook support groups can be enormously valuable, and the sense of community that you get from there and the information about lived experience and what works for other people can be so, so helpful. What I would say is, and this is something we see a lot at Marcel Action, be very mindful that those spaces tend to have a negative bias because the people who are using those Facebook groups and support groups are poorly, and they're probably at the more difficult end of things. So those spaces can feel quite negative, and there are, some frightening stories there. And the people who have recovered and got better, or who are living, with mild conditions, they tend not to be visible in those sites. So it gives us maybe a skewed viewpoint as to, you start thinking, oh my goodness, my life is going to be like this. I'm going to become poorly like that. So use those sites, use those groups, get the information that you can from them, become part of the community if it supports you, but don't let it suck you into the negativity and the worry, because, they have good points, but also bad points as well. And seek out positive stories. I would say, as I said, you hear a lot from the people who are very, very poorly, and they're quite visible in the community support groups. But it's important to search for positive stories and recovery stories, because there are people out there who have recovered and who can share really useful information about what helped them, bearing in mind that what helps one person may not necessarily help you, because they may have a different underlying cause for their fatigue. But it's useful to have that lived experience and that knowledge from people who have recovered, if for nothing else, just to keep your spirits up and to know that it's possible to improve your situation. Next slide, please, Vicky. So I mentioned their research, and it is so important to be informed when you've got a condition that maybe is not so well understood and there isn't that much support potentially from some avenues within the health service. It's so important to inform yourself and be ready to advocate for yourself, not just taking someone else's recommendation. If you see something recommended by someone in a support group, for example, do your research, spend some time looking into what that is, put it into Google and find some papers, find some evidence, look for research articles. So you can use Google productively to find good, well backed medical research papers and articles that can really help you to find more information about the different things that people are using and what works for them. And look for the lived experience to back up the claims. PubMed is a really good source of medical papers, and Google Scholar as well. Make sure that you're looking at peer-reviewed papers that are in well-respected publications. And I know that these can be, totally impenetrable, but you can find a lot of useful information just by reading the introduction and the conclusion. It gives you enough information sometimes to help you. Be wary, I would say, of ChatGPT hallucinations. I have come unstuck with this, and it does make references up. So do always make sure that you actually open the papers and read them if you are using something like AI. And look for websites that have references that link to research papers, because they are obviously grounded in evidence rather than just somebody making stuff up and just posting online. So find the ones that have references that you can then go and read those references and become more aware of what they're talking about. Next slide, please, Vicky. So if you're thinking about working with people, it's really important that you make sure that they're registered with the appropriate body. So if you're looking for alternative sources of support, complementary therapies, private doctors, maybe private nurses, allied health professionals like physiotherapists, it's always important to just make sure they've got those initials after their name, that they've done proper qualifications. And most practitioners will give you a free introductory chat, and make use of that, because it's so important that you get a sense of who they are and what they are going to be able to offer you. And at Marcel Action, we've produced a guidance on how to choose a health practitioner. So there's the URL there in the slide. If you go to our website at marcelaction.org and then type into the search bar, I think I typed in doctor, and actually that brought it up, but the catchy title is At a Glance, How to Assess Whether an MCAS Healthcare Service is Safe and Appropriate. If you look for that, there are some really good tips there on how to choose people to work with and make sure that they are the right practitioners. Next slide, please. So what I would say on that line as well, be really careful about thinking about what help you need, because what we see at Marcel Action a lot is people having very unhelpful experiences with medical professionals. For example, they say, oh, I went to see a specialist, I paid a lot of money to see a doctor, and they didn't give me any help with my diet. I asked him about food intolerances and I didn't get any help, and they didn't give me any support for my mental and emotional well-being. And sometimes what's happened there is there's a disconnect between what they wanted and the professional that they paid to see. So really make sure, think carefully about what you need. Is it diet help? Is it emotional help? Is it a diagnosis and a prescription of medication? Because each of those things will be a different practitioner who you need to see. So make really good choices before you pay for support or go and see someone privately, or even, ask for a referral within the NHS. Ensure that you're going to be seeing the right person who's going to give you the help that you particularly need. And be cautious about people who are touting for miracle cures, for example, and they're using things like the word cure, or fixing people, or having information and expertise that's only available to them, and they've developed a unique product that's going to heal you. There's a lot of that out there. And obviously this space invites people who potentially are selling a bit of snake oil, and there are unscrupulous people. So make sure that you have your radar on. Genuine practitioners will acknowledge that every potential treatment has limitations, and what they can offer may well be helpful for some people, but it's not going to be a miracle cure for everybody. And that people can be offering things that are supportive to us, and they can be really helpful to do that, but they may not cure us. Next slide, please, Vicky. So I mentioned ChatGPT, and there's a lot of talk about using AI, and obviously we need to be really cautious about using AI for health information, because it does have hallucinations, it makes things up, it makes mistakes. It's not a substitute for someone who's had medical training. Be really careful about uploading your personal data. People upload their test results, for example. Just make sure that your privacy settings are set really strongly for that, and you know what to do and how to do that if you are thinking of doing that. However, there is a benefit to it. And when we live with fatigue, it can save us hours and hours of searching sometimes. If you just type into an AI, please can you give me a list of all the organisations and charities in the UK that help and support people living with fatigue, and include links to their websites, you will get a list, and it won't be comprehensive. There will be things missing still, but it's a start, and it can be a low energy way of getting some information. Make sure you then always go to their websites and research them yourself. Don't just rely on ChatGPT. And use the different terminology, because again, when you put, please give me a list of all the organisations that support people living with energy limiting conditions into ChatGPT, you get a different list. So use the different terms and search and see what information you can find. And then you can also ask it to map those services specifically onto what you need. So, for example, as I've just said, think carefully about, do I need emotional support? Is this really, it's the emotional side that's affecting me? You can ask it, please find me organizations that help people emotionally with fatigue, or diet, people who can help me with my diet when I'm living with fatigue. So you can ask it to do some of the legwork for you. You do have to do some checking, and you can also ask for it to be local to your area, so make it specific to where you live. Next slide, please. So, as I said, we need to be really good at advocating for ourselves when we have these conditions that are maybe a little bit less well understood. It's harder to find the support. We have to find our voice and be prepared sometimes to really speak up for ourselves, and that can be really hard. So there are organizations that you can ask to help you with that. So Citizens Advice, PALS, if you're involved, have hospital appointments. Power, they are an advocacy organisation, the advocacy people, Voiceability, they're all advocacy organisations that can be useful for us to contact. Rethink is for people with mental health conditions specifically who need help. But again, that's out there as well. And again, at Mast Cell Action, we have an advocacy page on our website that has links to all of these organisations and some information about advocating for yourself. And I hugely, hugely recommend. I interviewed her last week, Penny Park. She's an author, and she's just published a fabulous book called How to Talk So Your Doctor Will Listen. And it's all the information. She has ME and MCAS and lots of health conditions. And she's gathered all the information together of how to get your point across in a medical appointment so that the doctor is more likely to be able to help you. And it's so, so useful. I can't tell you how much useful information there is in there. So we do have to become our best advocates, and that's quite a skill, particularly when you're not well and you're struggling with fatigue. So yes, get some support with that. Reach out to organizations who can help you. Next slide. And finally, I wanted to tell you about the PIF-TIC, which is run by an organisation called the Patient Information Forum, and it's a standard scheme for medical resources. So we are a PIF-TIC registered organisation at Mast Cell Action, and there's a huge procedure that you have to go through and evidence that you go through when you're creating resources, so that you ensure that it's been properly researched and that the evidence stands up to a certain standard and that it's been peer reviewed by people and it's been checked by users and it's accessible. And if you see that logo on a medical resource, you know that it's been created by going through that process, and so it's likely to be a credible piece of information from a reputable organisation. Obviously, not every organisation has the PIF-TIC, it's a voluntary thing, but if you do see it, it's a way to choose your resources and know that they've been well researched. So I think that's probably the end of my bit, isn't it? And I'm going to hand back to Vicky.
Thank you, Deborah. Thank you. And please, if you've got any questions for Deborah, pop them in the chat and we'll put all the questions up at the end. Right, this is where we go into that technical wizardry where I come off and Samantha comes on. And I'll let you do your introductions. Now, how do I stop showing that? Can everyone see that? I can see Samantha's slide, the connected support. Yes, I'm getting thumbs up. Over to you, Samantha. I've got a thunderstorm here, so I'm going to put myself on mute because it is so loud.
Thanks, Vicky. Okay, so hello everyone, I'm Sam Francis. I work for Lincolnshire County Council, and one of the main pieces of work that my team oversees the Connect to Support Lincolnshire website, which you should be able to see on your screens now. For anyone who hasn't seen it before or may have kind of heard of it but don't know much about it, we oversee the Connect to Support Lincolnshire website, and it's got a range of information on it for lots and lots of different topics and themes. Obviously today we are talking to you about the Energy Limiting Conditions Information Hub, but if you have a chance to have a look at the site in your own time and have a little explore about, we do have an awful lot of information about different topics, and it ranges across content pages that give you information, advice and support for different things, but also we've got some searchable directories on there, so you can actually search for providers, organisations, activities and events that might be happening in your area for various different things as well. So I am only going to give quite a high level description demo of the site and the energy limiting conditions part of the site today, but as I say, feel free to explore and in your own time and have a look at it. I've started off on the home page of the Connect Support Lincolnshire website. Vicky has shared the link in the chat, but if anybody isn't able to see that, I don't know whether sometimes when people join the call a bit later, sometimes the previous chat items don't show up. So we can share it again at the end of the session for anybody who doesn't know the site. It's very easy to get to the energy limiting conditions section of the site. When you scroll down on the home page, it's in our top set of tiles at the top here. So as I say, we have got lots of different information for health and social care and community information, but it's just this third tile on the top. And as Vicky said at the top of the presentation, we created the site originally around long COVID. So the information hub that we had, and you'll see there's a link right in the middle of the screen there that actually goes to the long COVID information pages that we've got on the site that still exist. We actually created that back in 2022. That's when we launched it, Vicky. So it was a fair while ago. And then the ELC hub has been up and running for about a year, and we are constantly developing it and updating it and checking the information that we've got on there. So we always welcome input from people if they know of different resources and things that we don't actually have on the site, so that we can link them in and make sure they're available for people. So what we've done within this area of the site is we've created a content section that has a focus on different topics. So you'll see down the right hand side there, as well as describing what an energy limiting condition is, because we know that some people might not know what one is, might not know which conditions fall under that category. We've also got different areas for the topics and the themes that somebody might want to find information about. So you can see we've got a whole long list there, including at the bottom local support groups and national and local support resources. So again, where we have the knowledge of say local Facebook groups or local face-to-face support groups that people can attend, we've got those in there, but we always welcome more information about those for any that we don't already know about or new ones that might get set up. Today I'm just going to show you a couple of the pages just to show you the layout and the format that we've got of the site. All the pages are very similar. We've tried to keep them quite brief in terms of the text on the page, so that you're not scrolling pages and pages and pages to find something, and it's very much brief descriptions and clickable resources to get to the website. Some of those ones that Deborah just mentioned in her part of the session, charity sites, organisations that might be supportive of different conditions. So just as an example, I'll go into the energy and pacing one. So as I say, very short pages, and then most of them have got a box at the bottom that just says more information about the following website. So we've got a range of different resources. Some of them are website links and pages. Some of them are blogs. Some of them are PDF booklets that websites have got attached to them. Yeah, there's a range of different things, leaflets, and what we have got on most pages across this hub is Vicky and colleagues put together a suite of podcasts. So we've got links to podcasts for each of the different types of topics in the sections, so you can actually listen to a podcast and listen to somebody talking about that particular topic. So as an example, managing your energy, and you can go in and listen to the podcast that's about that particular topic. Similarly, if I go into sleep and rest, Again, a fairly short description and some advice, maybe some information and advice and support within the description of the page. We've got some links, and again, the podcast link. We've also got some information from the Sleep Hub and the Sleep Charity in Lincolnshire. The range of resources we've got across the site do range from local organisations that support within the county, regional ones, and then nationwide ones as well, depending on where those charities are based across the UK. So again, you can see in there we've got a number of different resources, NHS resources, but also Chronic Fatigue Service, Sleep Charity, and Arthritis UK. So we've got quite a range of different ones in there. We've also got a wellbeing page, so that talks about health and wellbeing of individuals with energy limiting conditions. We do have some research papers linked, as Deborah mentioned in her part of the session. We do encourage people to sort of check the validity of research papers if they're looking at them. But again, some links in there for information around wellbeing. And then we've got things like, as you can see in the list, family, relationships and intimacy, recovery and self-care. We've also got some information around carers that, and that links into the energy limiting condition space. Information about and for children and young people, for families. And then we have got an employers page. So obviously we're aware that people with energy limiting conditions can face some issues with either staying in work or returning to work when they are dealing with their condition. So we've got some information in there about access to work funding, but also information for employers as well to support people that are living with those conditions. As I say, we have got the support groups and national and local support resources in the bottom page. So we've got links to Facebook friendship groups, and then email addresses for some of those local support groups within Lincolnshire as well for different conditions. But we always welcome more information about those if people know of something that's locally been set up in their area that supports people with different conditions. We've just got in the national, we do have some information around fibromyalgia, MECFS and FND organisations as well in there. So very much a whistle-stop tour of connector support. As Deborah said, the resources that we've got, they're not an exhaustive list. We would encourage people to do a range of research, so not only using this but also using Google and searching via Google, but being careful about the searches and the results they're getting back. But as a starter for 10 and a place where you can go and have a look at information all in one place, our information hub as it stands at the moment is growing, and we're developing it all the time, but it's a good place to start off. And as I say, there are bits of information separately on our long COVID information hub as well. I think that's probably it, Vicky, from me, unless there's any questions or anything that anybody specifically wanted to look at on the website.
There's nothing come up in the chat so far, but it's time to hand over to Helen. I've got some questions that I can ask that can stimulate conversation. But Helen, do you want to do your introductions? And then it might be that some questions come up specifically for Samantha or Deborah that we can raise.
Yeah, sure. Hi, everyone. Good evening. I'm Helen Cater. I've been living with MECFS for 8 years now. I've improved dramatically from being bedridden for the best part of 8-9 months to working part-time for a charity, which I really enjoy. And my experience is I went to the doctor, and the doctor gave me a piece of paper and said, "This is what you've got," tilted the head and said, "Good luck." And that was it, which is very disheartening. So it took a while for me to understand how I could improve things. Obviously, reading at that point was really difficult. Researching was very difficult and exhausting. So part of being of this group is that I want to make it better for others, better for yourselves, and have that information to hand. And we would like to encourage you to give some feedback, really, if there's anything that wasn't on the list that Samantha had mentioned on the website that you think we could possibly have a look at, or any questions that you have. We've got some events coming up, which will be more kind of specifically about improving and support and pacing and techniques, that kind of thing. But for now, in terms of support and information that's out there, has anyone got any feedback? You can just pop it in the chat if you'd like. No?
Yeah.
If you digest this and then you can think of something later, maybe you've been talking or you have after you've looked at the website, please do get in touch with Vicky. Vicky, has everyone got your email address?
Oh, I should put that in the chat as well.
Yeah. Absolutely, Christine. Yeah. It's a lot to take in today. Thank you, Vicky. So there's Vicky's
can
email
I
address.
ask you,
You can.
Julia? Sorry, Julia's got a hand up. Go on,
Sorry.
Julia.
My chat box isn't working, so I've been a bit quiet. What it is, I've had a diagnosis of cancer. I'm a year almost in a couple of weeks since I've had surgery and chemotherapy, so I'm a little bit, so you'll have to excuse me. My concentration's a bit already, and my eyes are blurring. So there's lots of information with regards to cancer. Not knocking it, but I'm finding I'm using an outside source more, mainly for the main reason I'm isolated a bit at the minute because my mobility is bad, and I'd probably explore more this side, if you like, of the county than I would go further. But I'm going to mention Penny Bron, who are based in Bristol. I've been using quite a bit for the well-being side of it, which obviously interconnects with fatigue, all the symptoms, what you're saying, obviously of the other conditions like long COVID and so forth. There's lots of information, but I just wonder, initial diagnosis, like Helen said, she got shoved a bit of paper. Well, I didn't even get that. I've had to push myself to find out my B12 and my iron levels are low, before I start sorting out the fatigue and whatever else side effects of chemotherapy. And I know there's a Cancer Alliance. Sorry, I'm blurdering on a bit, but I'm very compassionate about, because I used to be an advocate, so I sort of advocating for myself. But I don't know whether we could sort of connect something a little bit, when you're initially diagnosed with whatever condition or side effects like me after cancer treatment. Is there something, I mean, I find Macmillan was good. They've been fantastic with resource, but I got to different bits by researching or trying to research in a blurred sort of state, if you know what I mean. So I'm just thinking, like, if I had chemotherapy, and I'm not knocking at all the hospital, fantastic, but if there could be something that interconnected with not just cancer, with like a leaflet or something.
I've just seen there that both Vicky and Sam have shared something on Julia on the chat, and I'll let Vicky and Sam comment.
Yeah.
So yes, Julia, thank you. And
cancer, sorry, I'm going on a bit, but
no. Cancer support is something that we're very passionate about. I've facilitated a cancer co-production group in Lincolnshire for about the last 8 years, and it's absolutely one of the places my heart lies. And that group is working hard with NHS, with the ICB, to try and get information in a better state for people. I've put the link on for Cancer Support website for Lincolnshire, which is one place, but there's also, and Sam beat me to it, there is a section on Connect Support. I don't know, Sam, whether is it too much to ask you to just pop that one up live? And I've put her on the spot now. I love putting people on the spot.
No, it's fine. I had it open because I was going to share the link that you just shared, because we've got that on the page as well. So yes, just if it is of any use to anyone, it's another information hub that we've got on the site, specifically for people living with and beyond cancer. So yes, we've got a range of pages, and we've most recently added some information about children and young people that are impacted by a family member's cancer, but also young people with a palliative cancer diagnosis as well. So we've got a range of different pages, and again we've got some videos on there, some YouTube videos, but also some links out to our provider directories in there as well. So and as Vicky just said, the actual Cancer Support Lincolnshire website is linked in through that page as well. So hopefully that might be of help to some people. But again, yes, Julia, anything in terms of, you're right, pulling everything together in one place and having a really sort of snappy way of getting that information when you're at a point where you don't want to be scrolling through reams of stuff is always useful. So yes, we'll take that on board actually, in terms of making sure that this doesn't become too onerous as a hub for people to access, but hopefully some of the resources on there might be of use if they're not ones you've already accessed.
Great, thank
And
you
I
for
also,
that.
yeah, I also, Sam, just to add on, and Vicky, menopause as well has some quirky and overlapping symptoms that can run alongside of fatigue. I believe you've got projects that you've done for menopause. Is there anything on the connector support for that, Sam?
Yes, let me give me 2 seconds and I will share that one as well.
So while Sam's finding that, Julia, I've got a group which is for ladies with menopause symptoms as a result of cancer treatment. And they're looking at pulling together information. In fact, tomorrow morning we've got our meeting and we've got a postcard that we've designed that is about information and things for ladies experiencing menopausal symptoms as a result of that. Back to Samantha.
Yeah, it was just to share that that's the page. So again, if you go into the website, there are various different resources. We've got booklets, videos on there, and the information about the Menopause Moments project. That's a mouthful. Treatments, podcasts we've got on there, and then information about the Connect Plus downloadable health tool as well that the ICB have provided. So yeah, that link's now in the chat for people.
Brilliant, thank you for that. I'll
Julia,
definitely be looking.
Do you mind me
Yeah.
asking? I'm not asking for your address, but
No,
are you
you
in
carry on. No.
north, south, east, west of the county? Whereabouts are you?
I'm not good at geography. Is it easy just to tell you? Sorry, my head's. I never was good at. I got an O level in, would you believe, in geography, but I'm still no good. Cranwell, I live at.
Okay.
And I live down in the south. So that's sort of west, isn't it? That's the west. It's just that we also did a project with people in Mablethorpe, because one of the things that people in Mablethorpe that are experiencing cancer told us was that all the information felt very Lincoln centric. So we worked with them to develop a Mablethorpe specific booklet about really local information. And actually that's made me think, Samantha, maybe I haven't shared that with you for Connect Support. So there's something else for the to-do list, because that's focused specifically on the Mablethorpe area. But yeah, we'd love to hear from yourself or from others if you feel that there's any gaps in information. And it's always that fine balance. The one thing that especially people with cancer, they always tell me, is that timing is so critical. When you've been diagnosed, it's an awful lot to take in. And you're either given a piece of paper with a scribbled note on it saying, here, look on that website, or you're given nothing. Or sometimes you're given so much that you're just overwhelmed by it. And timing, I would think, for energy limited conditions is probably similar. You know, when you're told by the GP or the specialist, whoever, this is what your condition is, the information that you're given at that point can be so critical. It's really hard to get the balance right between too much information and not enough. And I'd just be interested in other people's experiences of information. What's the right amount of information? Where do you go to for it? And if you're happy to share, either come on the chat or shout it out. Thank you, Katie.
Vicky, I've got another comment in the chat, if you wouldn't mind. So, Christine, thank you for your comment. So people don't believe that you feel fatigue as you look okay at work and not sure how to fight it. I must say, Christine, I've been there as well. It's extremely difficult. And I found, someone might have some pearls of wisdom, especially Deborah, but I found as soon as you stop trying to convince everybody that you're feeling as bad as you are, that's when I started to feel better. It's exhausting trying to tell people. So I'm hoping that if you've got people, especially employers, that have difficulty, do share this information. If they're interested, obviously some might not be interested. But Deborah, have you got anything just off the top of your head where can support people that are trying to educate people that I look fine, but I feel horrendous?
Yeah. Well, in terms of work, there's Astrid. I don't know if any of you have heard of Astrid, but they're a charity that support people with energy limiting conditions to find work, and they have a training course for employers to do to teach them about energy limiting conditions and fatigue and what it means and how to support people in the workplace with fatigue. Obviously, that depends on whether your employer is interested in doing that course, but they do have resources, and it's worth looking at some of their information because they have some really useful resources. I think in terms of explaining it to other people, I think sometimes it's useful to frame it in the way that my body doesn't make energy efficiently, or it doesn't make enough energy. And the way I like to describe it is I think people get muddled up with between the idea of deconditioning and the fact that we're just lazy, or we're not doing enough, and that someone who maybe hasn't been exercising or whatever, their muscles get deconditioned, and the right course of action for them is to push through it and get stronger and exercise. But for people who have a fatigue condition, what the problem there is that their battery won't charge. So if you can imagine that you've got a mobile phone and every time you plug it in, the battery just doesn't fill up, the worst thing you could do would be to use that mobile phone a lot, because you would just drain what's left of the battery and it won't recharge again. And I kind of think that analogy of a battery that just won't charge, and it's a medical condition that means you don't produce enough energy and you can't recharge your battery. Sometimes that wording helps people to understand it more from a medical perspective, rather than you just saying, oh, I'm tired, and yeah, we all get tired, I'm tired too, which people often find is the response. And so just, yeah, I don't know if that's helpful to people, if that helps as a way to phrase it or to explain it to people.
Yeah, that's brilliant. Thank you. And there's just adding to that about exercise. So I had in my mind when I was told you've got to exercise, I thought I can't even get in a swimming costume. I'd have to have a lie down, never mind go and exercise. If you change the word exercise to movement, just movement round the house, up the stairs, it's movement, and it's on a level that we can, people with like chronic fatigue, not not CFS, but who live with chronic fatigue, to just think about movement, keep the circulation going. There are, I believe, some links to Qigong. Is that right? Yeah, we've got some nods going around. That's a nice kind of movement, gets the lymph nodes moving. That's where I get most of my build up, my pain is from trying to get the lymph drainage. It sits, it gets a bit stuck, and it needs movement. So just Tai Chi, that kind of movement, be brilliant. And walking, obviously. But I find even a 10-minute walk will put me in bed for a couple of hours. So pacing, pace, pace, pace. You've probably heard that so many times, but just listen to your body, sit down, just chill out for a bit if you can, and pace
I
yourself.
think, yeah, I totally agree with that, Helen. And I'd add that, I think we have as a culture, a society, we have this kind of skewed perception of movement and exercise, that you've got to do a lot for it to be beneficial. But actually, when you're in this game, you start to realize, there's been a study that 3 seconds, people who exercised for 3 seconds, they had a 12% increase in their muscle mass if they exercise for 3 seconds every day for a month. And so that kind of shifts your perspective of, if you can't do very much, but you can lie in bed and lift your arms up once or twice, don't think, oh, well, it's pointless, what's the point in doing that? It has benefit. As Helen said, it's moving your lymphatics, it's keeping your muscles and your joints mobile. So do whatever you can, the lowest amount. If you can stand on a step and do one step, every day. Do that. Don't think, well, what is the point? You know, do that one step, and then you might find that you can do 2 steps, or you can raise your arms 5 times or 10 times and build up really gradually. People are very hard on themselves. People beat themselves up and think, well, I'm useless, I'm not doing enough. And actually, tiny amounts of movement have real benefit, but it's so important, as Helen said, to work within your energy envelope. Don't push. 50% of what you feel you can do is the advice that I was given, and it's so important we get carried away and think, oh, I feel all right, I'll just do another 10, and then the next thing you know, you're feeling dreadful. So really listen to your body. The most important thing is to listen to your body and respect the signals that it's giving you, and move within your capability, and don't feel that you've got to try and push. It's not about Joe Wicks and Mr. Motivator. Even tiny movements are going to be beneficial for you.
That's brilliant. Thank you, Deborah. And again, think of the things that you have done throughout the day rather than what you haven't been able to achieve. I find that really useful as well. Turn it on its head. Oh, I haven't been able to have a shower today, or I haven't been able to do this, but you have got up and you've got dressed. You know, and if you're relating to work and explaining about work, I have a situation, well, I've got an arrangement at work where I work a certain amount of hours a week, but I can do it when I want to do it. I can do it around appointments. I mean, it's my employer is exceptional, to be honest, in that terms. But if you have got an adjustment somehow with your employer, that would be good if you could try and arrange that, or work afternoons. So I mainly work afternoons, maybe sometimes into the late evening, because I don't know if anybody else is like it. Very slow in the morning, and then bright as a button after 8 o'clock. It's like I have insomnia kicks in. It's cruel. But yeah, just work when you can, work when you feel good. See if you can get a reasonable adjustment made through your HR or your employer. Is there anyone else? Yep, just thank you. I don't know who this is from, but it says thank you for your presentation, Deborah. I can agree that social media groups can sometimes be negative places. Yeah. Well, right, everyone's come back very positive. Thank you for your comments. Thank you, Christine, for the feedback there. Scrolling down. Excellent. I think everybody's Qigong as well. Do you feel it was helpful? Very gentle movement like Qigong. Yeah, it's brilliant. So is there anyone else? And also, Vicky, I don't know if you're going to cover this off. If anyone wants to join the group, are you going to go into that?
We'll take anybody, we'll take them. Right, let me just bring this back so that I can just share this last bit of the slides. And then there might be some questions on this. So bear with me while I just line up the right slide. So thank you, everyone. What we have got is what's next. And we have got some further events, some in-person events. So we've got a series of pop-in events that are just being launched last night. Last night or yesterday was National Awareness Day for ME and chronic fatigue syndrome, and that's why I wanted to get it through on this timing. So we've got 3 events coming up. The first one in Grantham, the second one in July in Skegness, and the third one in Lincoln in October, and they're pop-in days. And we're going to be scheduling activities and speeches, talks, question Q&A sessions, and market stalls, not so much a market, but stands for people to share activities. And we'd love you to come along, but we'd also love to hear from you, because we're still organising them, if there's anything in particular that you would love to see at those events. So please do share with us any thoughts. If you'd love us to, I don't know, have a yoga session, or have someone talking about nutrition, or, what would you love to see at those events, those pop-in events? I'm just going to put that in the chat, because the schedule of those events are on our website. So if you want to make a note of them, you can find the link there. Let me take that off the screen because I'd rather, how do I get it off the screen? Stop sharing. There we go. You'd think I'd know by now what to do. So thank you. Love to have any feedback about those events. Please do shout it out or pop it in the chat. But otherwise, if there's nobody going through.
Well, I'd just like to add though, Vicky, thanks for today. So today was an information sharing and where you can go and self-serve. These 3 events are actually like a next step. So if you want some more information or to chat to any of the team here, please try and attend. It is face-to-face, so I know it's difficult. But otherwise, get in touch with Vicky as you digest this and give some feedback so we can make the advocacy better for people like yourselves going forward.
Definitely. And if you'd like to join us, we generally meet sort of roughly about once a month for 1 hour, about 5 till 6 usually on a Monday evening. So we try to make it not onerous at all, but if you do want to come along and work with us on how we can develop these events and maybe other things in the future, then do let me know. We're meeting slightly more often because we're getting these events sorted, but we do keep the meetings to 1 hour, and I do make sure mostly that we're out of the virtual door on time. Thank you everyone for coming along. I will follow this up with an email with the link to the events and some information, and I'll pull together all the links that we've had in the chat so that you've got them all in an email. And if you want to give us any feedback, we'd love to hear from you. But hopefully that's been useful. Go on, Helen. Go on.
Sorry, I'm always the talker. Sorry, everybody. Is this webinar is being recorded? Will this be shared anywhere so that people can review it again or share it with friends, family, employers?
Yeah, I can pop it on our website and make sure it's included there.
Thank you.
Lovely. Now this is perfect time, and anyone would think that we planned all this, but we said we'd have you out the door in 1 hour, and we try to stick to our word because for a lot of us it is tea time. So thank you for the feedback, finding it useful and informative. I hope we see some of you at the events, and take care. Thank you, and thank you to Samantha, Deborah, Helen, and Sharon for coming along as well. Take care. Have a good evening.
Thank you.
Bye-bye.
Bye, everyone.
Bye. Bye.
Bye.